What if a stroke didn't start with a collapse, but with a small, almost unnoticeable sign? Most people think a stroke happens suddenly. One moment everything is normal. The next, something goes terribly wrong. But in reality, the body often gives warnings, quiet ones, subtle ones, signals that are easy to ignore. And that's what makes a stroke so dangerous. Because those early signs don't feel urgent. They don't feel like an emergency. They feel like something you can deal with later. But time is the most important factor. Because with a stroke, every minute matters. Today, we're going to talk about 7 early signs of a stroke most people ignore. These are signals your body may send before something serious happens. And one of these signs is something many people experience, but never connect to the brain. Let's begin. The first sign is sudden numbness or weakness on one side of the body. This may affect the face, the arm, or the leg, often on just one side. Some people notice their arm feels weak, their leg feels heavy, or their face feels strange. It may not feel painful, just different. And because it's not severe, people ignore it. But this is one of the most important warning signs, because a stroke often affects one side of the brain, and that shows up on one side of the body. The second sign is sudden confusion or trouble speaking. This can happen very quickly. You may struggle to find words, speak unclearly, or feel like your thoughts are not forming properly. Some people notice, I know what I want to say, but I can't say it. Others may sound different, slurred, slow, or confused. Because speech involves multiple areas of the brain, this is a major warning signal. And the third sign is something many people completely overlook: sudden vision problems. This can affect one eye or both eyes. You may experience blurred vision, double vision, or partial loss of sight. Sometimes it feels like a shadow or a dark area, and because vision issues can come and go, people assume it's eye fatigue or age, but sudden changes in vision should never be ignored. The fourth sign is sudden dizziness or loss of balance. This may feel like spinning, instability, or difficulty walking. Some people feel like the room is moving. Others feel like they can't stay steady. Because balance is controlled by the brain, this can be a serious signal, especially if it appears suddenly. The fifth sign is a sudden, severe headache. Not a normal headache, not something gradual, but a sudden, intense pain, often described as the worst headache I've ever felt. This can happen without warning and without a clear cause. This type of headache may be linked to bleeding in the brain, and it should never be ignored. The sixth sign is something very subtle: difficulty understanding others. You may hear someone speaking, but not fully understand what they are saying, even though you normally would. This can feel confusing, disorienting, and it may pass quickly, but it's a signal, because language processing happens in the brain, and when that system is affected, understanding becomes difficult. At this point, something important becomes clear. These symptoms don't always feel dramatic. They don't always feel urgent, but they are signals that something may be happening in the brain. Now here's something extremely important. A stroke doesn't wait. It doesn't pause. It doesn't give you hours to decide. It moves fast, and every minute matters. Let's continue. The seventh and final sign is sudden difficulty walking or loss of coordination. This may feel like your legs are not responding properly, you're unsteady, or you suddenly lose coordination. Some people describe it as, I felt like I couldn't control my body properly. This happens because the brain controls movement, and when blood flow is disrupted, movement becomes affected. Now, when you look at all of these signs together, a pattern becomes clear. Weakness on one side, speech problems, vision changes, dizziness, headache, confusion, loss of coordination. Each one seems different, but they all point to one thing: the brain is not receiving enough blood. Here's what's really happening inside the body. A stroke occurs when blood flow to part of the brain is interrupted. This can happen in two main ways. 1. A blockage, most common. 2. A rupture of a blood vessel. When blood flow stops, brain cells begin to lose oxygen, and without oxygen, they begin to die. This is why time is critical, because the longer the brain is without blood, the greater the damage. Now, here's something you must remember. There is a simple way to recognize a stroke quickly. It's called the FAST method. F. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask them to raise both arms. Does one arm drift downward? S. Speech. Ask them to say a simple sentence. Is their speech slurred or unusual? T. Time. If you notice any of these signs, it's time to act immediately. This method is simple, but it saves lives, because it helps you recognize a stroke quickly. Now let's talk about what to do, because this part is critical. If you suspect a stroke, 1. Call emergency services immediately. Do not wait. Do not see if it passes. Time is everything. 2. Keep the person calm and still. Avoid unnecessary movement. Help them sit or lie down. 3. Do not give food or drink. Swallowing may be affected, and this can create additional risk. 4. Note the time symptoms started. This information is extremely important for medical treatment. 5. Stay with the person. Monitor their condition. Be ready to provide information to medical professionals. Now here's something most people get wrong. They wait. They hope it will go away. They think, maybe it's nothing. I'll see how I feel in an hour. And that delay is what causes the damage. Because with a stroke, minutes matter, not hours. Now think about this. What if the signs are small? What if it's just slight weakness, or mild confusion, or temporary vision changes? That's exactly when action matters most, because early signs are your only warning. Now let's make this simple. Ask yourself, do I feel sudden weakness on one side? Am I having trouble speaking? Is my vision suddenly different? Do I feel dizzy or unbalanced? Do I have a sudden severe headache? If any of these happen suddenly, do not ignore them. Now let's be clear. Not every symptom means a stroke, but sudden changes are never something to ignore. Your brain controls everything: your movement, your speech, your thoughts, your memory. When blood flow is interrupted, everything is affected. If you take one thing from this video, let it be this: the earlier you act, the better the outcome. Because a stroke is not just about survival, it's about how much function can be preserved. Your body will always try to warn you, through sudden changes, through unusual signals, through things that feel not normal. The question is, will you recognize those signals? If you found this video helpful, stay with our channel. We explain critical health signs in simple, clear ways so you can act when it matters most. And in the next video, we'll talk about something just as important: the early signs of a heart attack that most people ignore. Make sure to stay with us so you don't miss it.